Good afternoon, everyone. Welcome to another Marketing Moments webinar with Care Time and 52 Weeks Marketing. My name is Julio Barea, Vice President of Sales for Care Time, and I'm joined today by my very close friend and partner, Debbie Miller, founder of 52 Weeks Marketing and owner of Senior Helpers in Nashville. Good morning, Debbie. How are you?
Good morning. We've spent all weekend together, haven't we?
We did. We just spent the last 3 days together at the Home Care Association of America conference, and it was a really good time. I learned a lot while I was there. How was it for you?
It was fantastic. We met with so many owners, new owners, people that have been doing this. I met an owner who has a $65 million business, been doing it for 30 years.
Wow.
So, and then everything in between. It was just fantastic.
Yeah, I think the group was definitely, there were many very different types of business owners there than I usually see. I also saw a lot of really interesting folks in the vendor space that I hadn't seen before with some new ideas and some new things coming out. And so I spent much of my time educating myself as I was walking around learning what was out there. And I used those for a place to learn, as I'm sure you do too.
Absolutely.
So folks, before we get started, let me talk a little bit about, so today we are going to be talking about becoming the go-to expert, which is educating your community about home care. And then our next upcoming webinar is going to be on December 10th at 12 p.m. And it's going to be talking about what do they want from me in 2026. And Debbie's going to talk about strategies to discover what your referral sources think about you. That's a really curious one, and I kind of can't wait to see that. And there's strategies to set you up for success in 2026. So again, if you're one of our usual followers, please join us. We'll be here December 10th at 12. And if you're new to us, we do these every 2 months. And I think and we hope that the content that we provide to you guys works for you. Talking about what we're going to do today. So today we're going to be educating your community about home care. You're going to learn from Debbie how to discover and position yourself as a home care expert. In my business, we call that being consultative. In other words, working with people to provide them with information to improve their business prospects, and also practical advice for delivering value while building trust and credibility, which I think in today's age, Debbie, I find that trust and credibility is more valuable than it's ever been, which is intuitive thinking that there's more access to information than there's ever been. So
yeah.
Go ahead.
Yeah, I was going to say and we were talking about earlier how it's become such a competitive environment. And I think I may have mentioned this last time. We've had, I would say, 30 senior care companies launched this year. And look at all the new home care company owners that we met at the conference. Like it's mind blowing. We work with a master franchisor that's gone from 13 to 90 in a year. So everybody's really, really interested in this space. So it is so important for us to be able to differentiate ourselves and to really break through all the noise. And one of the great and creative ways to do that is through education and being that consultative support person, as you said. And that's what today's all about, is to really use education to market your business and to build your credibility. And you can actually do it really, really quickly if you're kind of focused on that. Bringing value is that's going to really set you apart.
I think it's the values that's so important. And folks, if you're on this call, I can tell you that when Debbie and I were at the conference this past few days, you have hundreds of agency owners who are coming in and they are absorbing massive amounts of information. And they're all looking for what Debbie's talking about today, is how can they be the best agency they can be? How can they provide the best outcomes for their clients? But more importantly, how can they stand out from the crowd? Think about it. Imagine yourself, you're in a room, as there was this weekend, where you have a keynote speaker and there's 350 agency owners in that room. And every one of them wants to do the same thing that you're doing.
Taking notes. They were all
taking notes, and they're all very focused and they're very motivated. And so in order to compete in that environment, we have to learn how to do things differently, and whether it's the product or service that we provide, or in my business where, Care Time is a software provider for home care agencies, when we talk to clients, and this is a very busy space, right? There are very many software companies selling software to home care providers. And we teach our folks that are talking to clients every day, focus less on what the software does, and it's about what kind of value can working with us bring to the agency owner that we're talking to. And that makes the difference. And I mentioned to Debbie, to you earlier, that in a world where we have so much information and so much access and communication, and yet that personal touch of bringing value to that relationship seems to be more important than ever. So I'm fascinated to go through these today as you go through it.
Yeah. All right. Well, shall we dig in?
Let's dig in. I'm all ears.
Okay. So, for those of you who don't know who I actually am a home care owner, first of all. So I have a pretty large agency in Nashville, Tennessee. It's a senior helpers franchise. Started from the ground up. Started with 10 caregivers, and we now have about 550 caregivers. We're generating about 8,000 care hours a week. So it's a good size agency, and everything that I'm going to share with you today, and everything that I typically share with you in any of the sessions that you may have caught me on, are things that I've done myself. And education, I'm very excited to talk about, because not only did I build my home care agency using these tactics I'm going to share with you today, but also I have a whole marketing program, whole marketing company that capitalizes on this very methodology, which is using education to help other agency owners across the country differentiate themselves. So, this is something that I'm really, really passionate about. What I love is that when you teach, it increases the level of trust that somebody has for you. All right, so we've got a lot of turnover out there in the community. And if you're that person that is providing consistently education that's focused around solving problems, that is going to help you build a relationship with your referral sources. It's and long-term relationships. So I'm going to share some anecdotes that I've experienced in my own business with my team doing this. It positions you as the trusted expert, right? When you're there week after week, educating the referral sources, helping educate their seniors and families, that again is going to really create more of a partnership opportunity, not just a vendor. Let me give you an example. I have a marketer that's been with me for 15 years. And she has used education in all of the 52-week system, all of that time. And we have one particular rehab center, a large CCRC. She calls regularly on the social work team there. And one of the social workers on the team, works for another home care agency. So it's at a competitor, and it's her best friend. All right. So my marketer would call on her, but she was, we didn't get a lot of referrals from this particular social worker, which she understood, right? She's showing loyalty to her friend. Until the day that this social worker's grandmother needs senior care. And you know who she called? She didn't call her friend's organization, she called ours. Because over all of that time, she was consistently in there, talking about specific educational points that she wanted to make about certain patient profiles. And in her case, her grandmother had dementia. Well, we had positioned ourselves as the dementia expert. So she turned to us, not to her best friend. I'm not sure how that went up, with their next girls get together. But so all that to say, it really does elevate you as that expert. And that's what it's all about. So when you educate, you're not selling, you're actually serving, and you're solving problems. And that definitely builds credibility. So as you can see, I get pretty excited about this. So what you want to do is obviously identify your audiences when you think about your program, what you want to focus on and who you're going to focus on. Obviously, your referral partners, your case managers, therapists, all of those influence centers that you're calling on, and those folks within those centers. seniors and their families and their primary caregivers, whoever they may be in that family setting. And then community influencers, right? Associations, professionals that are engaging with seniors and their families, elder law, those kinds of folks. These are all audiences that you could be focusing on and helping educate and helping them identify people that need problems or that have problems that you have solutions for. So let's talk about here the bringing value, and as we target each of those audiences, we're going to be using education to do a few things. So coming from a pharmaceutical background, education was one of the key marketing strategies that I used, where they're educating doctors often about some medical studies, certainly about patients that could benefit from the product. This is very similar model to pharmaceutical marketing, all right, which is where I came from, and I was able to apply the methodology to home care, and it works beautifully. But think about education to support, right? So we want to support the families. We want to bring clarity and confidence. We want to so that they know they're getting that support when they think about us. Okay, so explaining complex conditions, medications, home safety strategies, and doing that in plain language. So we help them know that they're getting supported, especially when they're feeling overwhelmed. So again, depending on the audience, support's going to look a little bit different. When we're talking about our referral sources, it's supporting them, taking things off their shoulder, things that they would love to have time to communicate and educate their patients that they don't. So by passing the baton to me, they know that their patients are going to get that education and support. The next thing is we're going to educate to mobilize. All right. So think about education also leading to activation. All right. So the more informed someone is, the more likely they are to act. Right. So mobilizing means helping people understand the why behind taking the next step. All right. So for example, we want to encourage hospital discharge planners to refer sooner so that we can prevent readmissions, right? Get us involved earlier prior to the discharge so that we can get into the home and deal with the issues that often lead to readmissions. So those are the kinds of educational conversations that we want to be having with those folks. Information's power, and power drives action. We want to mobilize them to take action. Also, we want to persuade them, right? This builds trust and credibility, which makes persuasion ethical and effective. So I will often say to discharge planners that we sometimes, as a discharge planner, you have a bias. I'm actually very upfront with them. You have many social workers or discharge planners have a bias about the cost of care. And I say, but you have no idea what's going on behind the scenes. And you owe it to them to at least share some options. And here's why. All right. And then I share some actual stories about folks that had no idea. Julio and I were just talking about how in 2025, there are still so many people that don't even know that home care is an option. And if nobody tells them about it, they struggle through this and end up back in the hospital. Right? So we want to persuade them to take action, to intervene when it's necessary. And that's when we're educating about who those particular patients are that they definitely want to focus on. And then finally, changing behavior, right? Education reframes habits, reshapes perceptions, and reinforces the action that needs to be taken or the choices that, say, families and seniors are making. So, for example, teaching seniors how daily movement reduces fall risks, or how changing things around in the room can help reduce risks. All of those kinds of things are going to change the way they look at things. So we ultimately want to help change behavior in the education that we're providing. Okay, now, when it comes to community marketing, and I'd like to just kind of really quickly give a quick overview of the 52 weeks methodology, okay? And I'll show you where education fits in here. So we built the system and education, think about reach, frequency, consistency, and accountability, reaching the right people that are interfacing with seniors and their families, frequency, visiting them often enough. And I believe that you need to be seeing them on a weekly basis, your referral sources, because most of them have weekly needs. So you need to be in there weekly, talking and educating and reinforcing where you can help them. And then consistency, solving problems, and then accountability, holding the team accountable to all of these things. So here's where education can really support these two key components, frequency and consistency, because it's awfully hard. It's easy to hire a marketer and say, go get me referrals, go see your referral sources weekly, but what in the world am I going to talk about? So I met a lot of people that we were reviewing this system with, and they're like, oh my gosh, I've been waiting my whole lifetime for this kind of thing, because I don't know what to talk to my referral sources about. And education gives you something specific that you can focus on. It gives you a business reason to call on somebody versus trying to show up and, talk about their kids. They don't have time for that. Okay. So making education part of your weekly routine, using your weekly touch points to, focus on something, whether it's a patient that has an issue, and then you can educate them around that. Share printed tools. You might have little lessons, case studies, articles. I love incorporating science into education, because a lot of times we're calling on folks that have that kind of background, right? Doctors, nurses, social workers. They respond to statistics. We'll talk about that in a minute. Certainly anything that's published. Those are all things that you can come in with and change it up, right? Keep it interesting, mix things up. Go on a podcast, talk about these things. So you find creative ways to thread education through everything that you're doing. Schedule presentations, lunch and learns, do virtual educational sessions, family nights at an independent living facility or assisted living facility. So choose formats that match the audience, obviously. But at the end of the day, there are lots of different ways that you can incorporate your education and different channels that you can use to get the message out there. All right, the hidden gaps. So where is knowledge lacking that we can help fill those gaps? A lot of families don't know what care is, that's an option, what's involved, as we were talking about earlier. So we want to find ways to educate families. This is an incredible, viable option for them. Professionals underestimate the power of home care and what we can do to help them achieve the measurements that they are being held accountable to. Readmissions, hospitalizations, client and patient satisfaction, all of those kinds of things. So we have to educate them about how we fit into their continuum, and again, persuade them to think about us and think about us earlier than later. Very few people understand payer sources, so we can educate them about that. Things like how to activate a long-term care policy. What is the process for getting VA benefits or Medicaid benefits? So you could do a whole flyer on how to apply for Medicaid. Go to this website, do this. I mean, the really great resources and tools that you can create to support whatever education it is that you're out there delivering. All right, it's always great to align with community needs, right? So educate around what matters most, like hospital readmissions, as we talked about, chronic care management. 75% of seniors have at least one chronic condition. Very few people have their condition under control, which is why we have so many hospitalizations. So these are all really important needs that we want to focus on when we think about our educational program. Family caregiver burnout is a huge problem. dementia is growing need, fall prevention, those kinds of things. And I'm going to give you some specific ideas on what you may want to focus on and build some campaigns around. And also, I'm going to give you examples of tools that we use within my own organization. So let's talk about some key subject buckets, all right, based on what I just referred to as some of the needs in the market and some of the educational gaps. So let's look at health and condition management, first of all. Key thing that you want to be articulating is how we can prevent hospital readmissions, manage post-acute transitions, okay? Understanding early signs of cognitive decline, medication safety and adherence at home. These are all great topics. You could take screenshots of this and, just create some educational tools around that, like an example here that I have. Avoid emergency department visits. Notice I got an article, I've got some statistics in there to get that conversation going. And then how home care is a solution for that. Managing mobility issues. So think about when you're doing this on a weekly basis, you can pick one topic that reinforces how you support health and chronic condition management. That's the ultimate message, but lots of different things that you could be focusing on different week after week that, again, positions you as that expert on health and chronic condition management. All right, let's think of another topic here, home and safety and dependence. So we can talk about home modifications that reduce fall risk. Talk about technology that support aging in place. Boy, do we see a lot of folks at the conference that are introducing a lot of technology solutions for detecting potential risks in the home, those kinds of things. Fire safety, seasonal safety topics like heat. Depending on where you are in the year, there's lots of different things that you can focus on. Here's an example of a tool to support this category that we use, one of our weekly tools. Some simple precautions can ensure safety and reduce your risk of falling at home. And it's like a very useful safety checklist that they could pass on to their clients, that families could use themselves, that as a home care provider, what are we doing? We can be saying, this is what we use when we do an assessment in the home. And again, you're just elevating yourself, bringing value to that referral source that no one else is doing out there. So I just wanted to give you some ideas. I always like to put my money where my mouth is when I'm, these aren't just like pie in the sky ideas. These are very actionable things that you can do to help position yourself as that expert. All right, but here's another category, caregiver support and mental health. We've got 54 million family caregivers out there now, guys, and they are burned out and stressed out, and they need some help. And this is where one of those areas where we want to mobilize our healthcare partners to intervene when they see these families stressed out. And here's just an example of a tool. This was actually something that was published in AARP. It was a stress test that family members could do. And of course, everything here is always pointing to home care as the solution, right? You've got a family member, hey, if they tick any of these boxes, if they score, this on the stress test, recommend our services. So what am I doing? I'm persuading them to take action, to, not to just don't sweep it under the carpet. Ethically, they need to be directing these families. And if any of you are on the call that are family caregivers yourselves, you know how important this is for somebody to make those recommendations. Okay, let's look at another category, care coordination and healthcare navigation. So communicating effectively with physicians and care teams, understanding the difference between home health and home care. Do you know that we actually had somebody we spoke to this conference literally didn't know the difference between home care and home health. Families are very confused about this. And here's another area where we want to mobilize our healthcare partners to help them understand this. Because when they transition home with home health, and the patient and the family thinks that they're going to be getting the same level of assistance that they were getting in the hospital, say with their ADLs, and all of a sudden home health doesn't even get in the door for 2 days to begin with physical therapy or whatever, just even to do the initial assessment. Meanwhile, who's helping them get to the toilet, to do the showering, and all those things that they were getting assistance with at the rehab or the hospital? And now families in crisis. So encouraging them to educate early. This tool can actually help your provider educate them on what to expect. So again, we're not only educating the family, but we're arming the healthcare professional to be in a position, giving them resources to educate their patient base also. And of course, we'll always have our branding and positioning to position our services as a solution. All right, so this is the last category that I want to talk about: financial and legal preparedness. A lot of folks don't know about payer options. That's a great one to educate on. Also around advanced directives, power of attorney, those things that they need to be thinking about. Only 1/3 of seniors have a power of attorney or advanced directives, or have even talked to their family. And you could do a whole lunch and learn or a whole presentation at an independent living facility or an assisted living facility on just this topic. So, so this is a great one that is very focused on. And by the way, healthcare professionals are dealing with people that don't have power of attorneys at all. We have a lot of folks with this particular tool where they keep it in their file and they give it to their family so that they know what they have to do when they say leave the hospital to get this done. So again, just value add, right? And every time they pull this out, our branding is on there. So just giving you ideas. Oh, this is the last one: community awareness and prevention. So, helping manage around those chronic conditions. So pick a chronic condition. It's a great place for you to niche yourself, like with those top readmissions, chronic conditions that lead to readmission: COPD, CHF, pneumonia, falls. So a lot of things that you want to educate around that are leading people to those the emergency room, as an example. Recognizing when fine isn't fine, early warning signs of decline, those kinds of checklist kinds of things where they can recognize in themselves, oh boy, it's time for home care. All right, so again, always wanting to encourage them to take action. So ultimately what we're trying to do here is paint a patient profile so that when our referral sources see this scenario, all right, they think of us. And as you continue to add more and more scenarios, more reasons for them to hand out your phone number, you then become their preferred provider, because there is no scenario where you cannot help them. There is no patient situation where you cannot help them with a home care solution. So that's kind of like each week you just keep building. You're consistently in there with really relevant information that helps them do their job better. And before you know it, you're their partner. And that's how you really get those relationships to that partnership stage, which I often talk about. All right, so let's talk about some of the ways that you can be out there and sort of ways to be effective with this. Okay, so first thing is you want to use tactics that are going to get their attention. All right, I love starting with statistics. All right, and I'll even mention journals, or if I use a statistic, I'll say according to the Alzheimer's Association, blah, blah, blah. Okay, so really get their attention using statistics. Tell a story. All right, if you have a relatable situation that you've been able to, or a client as an example, and I'm going to give you an example of this in just a second. Show the why, validate that you understand what this person is going through, and that shows your empathy, all right, that you're really compassionate and passionate about what we're doing here and the difference that we're making in the lives of our seniors. Um, the, you know, one of the things here is present the how. Okay, so what is this going to look like for that family? And I've got a kind of a nice summary of this. Okay, so think about it in this sequence. State the problem, validate their pain points, whether it's, you know, if you're focusing on your referral partner that has a pain point, maybe it's, I don't have time to deal with this family. They're not on the same page. I can take that off. Here's what I do in a family meeting, blah, blah, blah. And then present the solution. All right, so state the problem, validate the pain point, and solve the problem. All right. So I did want to give an example. I think I've got an example coming up here in just a second. Okay. Did I miss something there? Okay. Okay. So another tactic here is to co-host some educational events with your community partners that add credibility to you and to your organization. So I wanted to give you an example. I last week was a speaker at the Alzheimer's Tennessee big conference. All right. So what does that do? And by the way, boy, did I sent this to everybody and their brother in our database, right? So they're seeing Debbie Miller.
I got it. I definitely got it.
Yeah. Yeah. And so and what's awesome is you're capitalizing on all of their marketing also when you host something. The next example here, this is coming up next week. I'm doing a long-term care insurance seminar, and we've partnered with an elder law office that does a ton of work with seniors. So what have we done? We're credible here because we're partnering with this elder law firm, and we're doing it actually at their office. And now I'm tapping into their customer base. Right, these are people who I know have long-term care policies, and I can help them activate that, tap into this incredible payer source, and get care going. And so these are just examples of things. When you partner with somebody, you are definitely multiplying your reach and increasing your credibility. All right. So one of the things to do also to think about is repurpose what you're teaching. All right. So it doesn't have to be, okay, I've got to teach on dementia tomorrow and this, and thread your, like, you know, really lock down a good, say, seminar or a presentation. And so what I'm showing you here is on the left-hand side, there where I was doing a dementia training at a facility. And it was an independent living facility, and I assisted. And we were calling in families who have loved ones who have dementia. And I was training them on dementia techniques, dementia care techniques. So when you think about dementia, right, there's and a lot of what I train in that seminar or workshop, I started to then thread or incorporate into a multiple resources that have a lot of we can get a lot of mileage out of. So we can, you know, 1 week we might go into our referral sources and talk about this. Of course, November's coming up. That's big Alzheimer's month. So, you know, we're going to do a whole campaign around that. But it's all stuff that I've already got. And we're just repurposing it in different tools. One, there are 10 warning signs of dementia. Great for doctors' offices. What am I doing? Every time I talk about dementia, I'm elevating myself as that dementia care expert. So who are they going to think about when their grandma has dementia, right? And that's what happened. They truly are, you know, I've just gained so much credibility because I've built out this whole, looks like this big program, but it's all the same information, just kind of regurgitated and reformatted in different layouts and different resource tools. All right, so real stories win hearts. I love utilizing stories to help us really make a point, right? So you can use scenarios. You know, of course, you know, it's good if you're kind of new at this. and you use somebody else's story and make it your own if you don't have any stories of your own. But then begin to build on situations that were, certain families that you've been able to help where you've really made a difference, that you'll be able to incorporate that. So real stories really make what you're teaching extremely memorable. You've seen good presenters and bad presenters, right? And probably a big difference between the good and bad was a story that was very, very memorable. So I want to share an example of this. And this is, I don't know if you remember this, Julio, but I wanted to cover this in one of our previous workshops and we ran out of time. And I call it the tale of three sisters, okay? And so whenever I have an opportunity to share this story, I will incorporate this into, if I'm doing, say, a work, or I'm even just doing a little presentation at a case conference for hospice company or home health agents and things like that. And so what I talk about is the tale of three sisters, and this is a true story. All right, so this happened several years ago. I got a call from a client, or from a potential client. She was one of the three sisters, okay? And her three sisters were taking care of Daddy. And Daddy at the time was 95 years old, okay? And these three sisters were in their mid-70s, okay? And so I book the assessment, and I go to do the assessment, okay? And what I learned, and so the eldest sister was the person that I met for the assessment. So here's the backstory. These three sisters, not one of them lives in Tennessee. They live all over the place. One's in Ohio, one's in Kentucky, one's in North Carolina. And so imagine, these are 75-year-old ladies, okay? And 6 years ago, their mom had died. And then Dad went into a really bad depression, and he wasn't eating. He became very frail. He was put on hospice for failure to thrive. All right. He was given about a prognosis of 3 to 4 months to live. So, but he didn't want to leave his home. So that was the situation. And so the sisters together decided, okay, what we're going to do is we're going to take turns taking care of Daddy at home so that they can support his wish to die at home. So that was the plan. So they each took turns. They would come into to Tennessee, to Nashville, stay with Daddy, leave their life, and come and spend a week. So they did these 1-week rotations to take care of their dad. And this was their commitment to them to see him through to the end of life. So when I met this lady, this was 6 years later.
Wow.
6 years they had been doing this care rotation. So now they're in their mid-70s. They have their own health issues. One of the sisters' husband had cancer. So this was getting really, really difficult, okay? And can you imagine, they thought he had 3 to 4 years, 6 years later.
Wow, it's amazing.
So in those 6 years, and by the way, they think about everything that they were doing for him, okay? They'd gone to the doctor's office, all the people that they interviewed, the hospice company, they were no longer on hospice because he was thriving, all this. So no one told them about home care. No one. So 6 years. So here was the saddest thing. She was very teary because they were at their wits' end. They were starting to build resentment, and here's why. When I was walking through the home, I was doing my tour. There's a long hall to get to Daddy's room. They call him Daddy, I walked down this hall, and in this hall was sort of like it was full of photos. Their mom and dad had traveled all over the world. And it was this gallery of photos of every place they had been, Paris and Rome and all over the hall, this long, narrow hall covered in these framed photos. And I said, wow, did they ever have a life? And, she said, yeah, they had an incredible retirement. And she stopped dead in her tracks and she looked me right in the eye and she said, This is what they did with their retirement. This is what we've been doing with our retirement.
Wow.
It gives me goosebumps. I literally get tears every time I think about this. This is what they've been doing with their retirement. 6 years later, they were leaving their family, all of these things. So I tell this story to these healthcare professionals. Why? Because I want them to recognize and to mobilize them to take action, to recommend home care services, because that is just so. Do you know how they found out about us? She was in the grocery store with her dad. My caregiver, one of our caregivers, was in the grocery store with our client. She had a badge on. She asked, "Oh, what are you doing?" She said, "Like over the tomatoes." And our caregiver, she had to find out about home care in the grocery store 6 years later. So that's a story that really gets their attention, and especially with hospice, because I say, look, that this is a tough time for families, and it's extensive amount of care hours that are needed. So recommend us, we can work alongside you, blah, blah, blah. So you can see how memorable a story like that can be. And it's authentic. This is, just, you talk about caregiver burden. And boy, it was such an incredible, and here's the end of the story. Are you ready for this? We cared for him for another 6 years.
Wow.
He died when he was 102. Isn't that something? So they looked after him for 6 years, and he lived another 6 years.
And he was in hospice to start.
He was in hospice to start.
That's an
Failing
amazing
to thrive.
story.
Yeah.
Wow.
Yes. So I have goosebumps just telling the story. He lived to 102. He had the most incredible fig tree outside of his house. That's one of the reasons why he didn't want to leave. He didn't want to leave his fig tree. It's amazing. Yeah.
That's a great tree.
So find us, you probably have these experiences where I've gotten seeing lots of hearts and stuff. That's cool. All right. So brand yourself as the educator that everyone is going to call on. Okay. Be that trusted voice in senior care. Your agency is going to gain credibility. You're going to build brand recognition, and referrers are going to associate your name with solutions that their seniors need, that they need, because they don't have time to educate their patients typically. But you want to, you want to kind of position, look, it comes down to kind of an ethical situation now where these folks need resources, particularly for social workers. And that's what education does, is it persuades them more in a kind of an ethical way. All right, so overcoming behaviors. Here's what we hear sometimes. Well, I don't have time. I don't have time to do presentations, or I don't know what to teach. I'm giving you a bunch of ideas. Start small, pick a topic a week, focus on it through, as you go see all your referral sources, stick with one topic for that week. Makes it really easy for you. But I know it's a lot of work, because to be honest with you, that's what the 52-week system does. Makes it, we're basically building whole educational programs so that our clients do have something different to talk about and educate their referral sources. So if you don't want to do this yourself, we can make it really easy for you. I know it sounds like a little bit like a sales pitch, but I met with so many home care companies that saw this, our methodology, and saw this packaged up, and they just said, oh my goodness, that would save me hours and hours and hours. People that don't have sales and marketing experience, that haven't taught before. It is basically a turnkey system with all the tools you need. You have something fresh and new to talk about every single week to educate on. And it gives you weekly talk tracks that guide you on what to actually say. And then there's a CRM to keep you on track. So you get visual aids, you get these tools and resources that help you educate your help your referrer educate their seniors and their families. And a lot of these things you can actually use even in assessments to educate your families. All right, so, wow. That brings us to, I think we're getting close to wrapping up here, Julio.
We are absolutely getting close to wrapping up, but I'm still recovering from your story about the three sisters. I have to say that is the most heartwarming story I've heard in a very, very long time, Debbie. And what it says about the impact that home care can have on people's lives is even more important than anything else. It's one of the, you've talked about this before. I know I have. The reason we got into business was out of, a personal relationship with folks who needed care. And I told you before this that I didn't know personal care existed until I had someone who needed help. And so it's amazing the impact we have on people's lives like that. So folks, you had time to learn all about Debbie's 52 Weeks Marketing and her beliefs and her true passionate love for the business. I've known Debbie a long time, and she lives and breathes this business. She is an owner as well of a home care business, a very large one, as well as the owner of 52 Weeks Marketing. And I don't know anybody that's dedicated more of their time to this business. So if you want to learn more and you want to schedule a demo, please click on this and submit yes. She'd love to learn to know more about you. And then if you folks want to learn a little bit about Care Time, I think we have a slide in here. I believe I missed it. So there's a lot of software companies out there, and you likely have spoken to many of them. And one of the things that we like to share, our mission is to really help make agencies more efficient. We understand how difficult it is to run this business. We understand how hard, and our job is to just be a partner that will help you make your agency more efficient, make more money by helping you retain your clients, help you get paid faster by helping you with your billing. And these are things that we feel will help you to really focus on what you're here to do, which is provide great outcomes for your clients. So Care Time does billing. We do billing for your agency. We do billing for other agencies. Our software provides onboarding, caregiver engagement, billing management, communication, and scheduling services. And we're connected in EVV in 37 states. So if you'd like to learn a little bit about us and meet some of the fantastic people I have working with agencies, please click on the call. We'd love to get to know you a little better too. All right. On that note, December 10th, 12 p.m. EST, we're going to do more of this. What do they want from me in 2026? You'll get to meet more of the stellar duo of Debbie and Julio. We'll do this again, and we look forward to doing it next year.
Last one for the year.
It is the last one for the year. For more information, there's our websites. There's all our information, caretime.com, caretimeus.com, 52 Weeks Marketing, Helper Heroes, and my nephew, Dylan Schwartz. He's going to love that I said that publicly. Is there if you want to contact 52 Weeks Marketing. Debbie, another great time. Thank you for meeting me today. I really appreciate it.
Yeah, and it was great to spend a lot of time with you this past weekend. And hey, guys, go out there and make, share what you do, like that story. It's like Julio said, we do an amazing work. Sometimes we lose sight of that because we get caught in the putting out the fires, but it is amazing what we do on a daily basis and the difference that we make. So get out there and educate people.
And kudos to all you folks that are out there.
How are we getting all these?
I know. It's a lot of love today, Debbie. It's you, though. It's not me. It's definitely you, for sure.
I love that. I love that.
That's really cool.
Yeah.
Well,
awesome.
Thank you, folks. This is the end of our time.
Thanks to Casey and Rachel behind the scenes also for always. We had a few challenges this week, but we pulled it off.
That's where we shine, is in the challenges. Thank you, everyone, for joining, and best of luck out there. Keep doing the good work that you're doing. We'll see you again next time.
Bye, everybody.
Bye, everyone.